Thank you. Good morning, everyone. Before I start, I want to just give you a little disclaimer. We're not going to go into all the details of Medicaid and Medicare because it's actually more complex than disability benefits. The objective is, I guess I hear people say often, I have Medicare or I have Medicaid or I want to enroll in either one. And that's a real wide open statement because there are multiple plans in both of the different types of services that we have. So that's my thing, is to just give you a little bit of insight into all the different Medicares and Medicaids and who's eligible and when it matters. Okay. The agenda, what is Medicare, Medicaid, disability benefits. People are often confused when they receive disability benefits as to which type of health care they have. So we'll go into that. Then the different types of each plan, Medicare and Medicaid. So what is Medicare? It's an insurance program that's paid with trust funds that you paid into. So we're working and paying into the Medicare plan so that when we become, if not disabled or ill before age 65, we can then enroll and have Medicare coverage in our later years. It primarily serves those that are 65 and over, but people who have a certain type of disability benefit are also eligible for Medicare. In this plan, people pay. They pay for Part B and Part D premiums. I'll go into what those different parts are in a moment. It just has many different facets to it. And then Medicare is a federal program. It's the same everywhere in the United States. Doesn't matter where you live at. You can have whatever plan you have in Ohio is the same plan you have in Florida. Unlike Medicaid. Medicaid's an assistance program. That means you have a need for health care. You're not eligible for Medicare. You're not working or employed with a company who offers health care. And you have usually low income. It does serve people of every age, children up to however old, death. Sometimes a small copayments required, but I have never, ever seen that in the years I've been working with it. And it's a federal and state program. It means a federal program, but it has state-specific laws. So the rules for Medicaid in Ohio may not be the same as the rules for Medicaid in Florida. It can differ, I should say. So put a little chart together. I think these charts sometimes help divide or separate what they are. So specifically, many of the individuals that we serve at Fairfield County Board have or are eligible for supplemental security income. When a person receives SSI or becomes eligible for SSI, they are automatically enrolled in Medicaid. They don't have to apply. That's a change that's happened over the last 5 years. It comes with it. You may be eligible for it if you're aged, blind, or disabled and have a financial need. I don't know if you've ever heard this, but that's often called ABD Medicaid, aged, blind, or disabled. And beneficiaries who then may have Social Security disability insurance, there's a wait period for Medicare. So initially, in most cases, unless their Social Security disability insurance monthly benefit is high, and it can be, they have to wait 2 years to become eligible for Medicare. I have seen many people who receive SSDI are not eligible for Medicaid, and they don't have any insurance. They're not working, so they have to do marketplace insurance. And Medicaid, no cost to the beneficiary. Medicare, for those who receive SSDI, you have a 2-year wait before you are eligible to enroll in the Medicare. Once you become 65, and I never thought I would ever want to be 65, but I can't wait to be 65 and get Medicare. I was a person at one time that was paying an enormous amount of money for monthly health insurance. So it's a very good benefit. For individuals who are diagnosed, no matter what age they are, with ALS or ESRD, end-stage renal disease, you're automatically eligible. There's no limits, no fine, nothing. You're just automatically eligible for the Medicare. And what a lot of people that I work with are surprised to hear is when they receive Social Security disability insurance, if they work themselves off of it because of earnings, meaning they're making too much money to continue with the disability cash benefit, they still keep their Medicare for up to 8 years. And that's a big plus when we're working with the disabled community and wanting to get them back into the workforce, or they want to be back in the workforce. I find that most individuals' fear is not losing that cash benefit, it's losing the medication, the healthcare plan. Because as we know, some medications can be an enormous amount of money. So they can keep it typically up to 8 years after they lose SSDI benefits. The costs vary depending on the plan, but it can be cost-free if financially eligible. And this is kind of a pet peeve of mine, and you'll see that here in a minute. So here's Medicare plans. Like I said, you think Social Security disability benefits are complicated? And I'm also a Medicare counselor. So I've been trained and educated in all these plans, and I still have to go back to the book and go, no, which is which? So there's 3 parts to Medicare, basically. Part A, it's hospital only and it's free. I get a lot of questions from people who say, well, I am going to have health care through my OPERS or my STRS retirement. I'm not going to sign up for Medicare. No, sign up for the Part A. It's free. And then also offsets any out-of-pocket costs. And I say free for most people because it depends. If you have a really large income, then you may have some type of a premium that you have to pay. Part B, this is the doctors and the tests. That's part of Medicare. That premium changes every year. This year it's $148 for most people. And then Part D is prescriptions only. It averages between $35, $50 a month in premiums. Again, that stuff, all the numbers, like everything, change every year. When someone says they have original Medicare, this is what they have, A, B, and D. Okay. Part C, now this is where it gets really crazy. Medigap or Medicare Advantage is a Part C plan. When a person has Part C, they've got an extra supplement. So if I back up a minute, original Medicare pays 80-20. 20% out of pocket, 80% paid by Medicare. If you want a supplement or more of those healthcare costs covered, you typically enroll in a GAP or an Advantage plan. The difference is the GAP is a supplement. It fills the gaps of original Medicare, the 20%. The Advantage is regular Medicare, but you get a lot of different perks with it, if you will. And then there's all these different types, HMOs, PMOs, special needs plans. A lot of the people we work with are in Advantage special needs plans, or I get them enrolled in them. You get some dental, vision. You could get all dental, all vision. You could be eligible for silver sneakers. You could have a healthcare plan. You could get transportation with the Advantage. So when you see commercials on TV, and I'll say more about this in a minute, when they talk about all the extras, that's an Advantage plan. And there is a difference between the two, the Advantage and the GAP. Then we have what's called a Medicare Premium Assistance Program. So I've got my iPad over here, and I have a TV going sometimes. And there's these commercials constantly on cable TV. Premium free Medicare. Get this free. People don't know it's all free. There is absolutely no premium free Medicare unless you are eligible financially because of typically a low income. And that's where these Medicare premium assistance programs, or sometimes called savings programs, come into play. It's Medicare insurance, but Medicaid pays the Part B, copays, coinsurance, and deductibles. And then the individual is guaranteed for Part D extra help. What's that mean? It means you have zero or very low levels of copays for your prescription drugs. You have to meet certain financial eligibility thresholds. There's 4 different levels. QDWI is very non-typical. That's when someone has lost Part A because they have too much income. The majority of the people that I work with or that I see that are in an MSP or an MPAP plan, they're in a qualified Medicare beneficiary or a specified Medicare beneficiary plan. It means they have income below these numbers, and that's why they're eligible for it. So when you see that stuff on TV, this is what they're talking about. They don't tell you you have to have low income to be eligible for free Medicare. Okay. Medicaid, these are most of the types of Medicaid. So people call me or caseworkers call me and they say, oh, my person has Medicaid. Well, which Medicaid do they have? No, it's just Medicaid. Well, it's probably not just Medicaid. Regular Medicaid is what I said before, the age, blind, or disabled. Then you can have what's called a modified adjusted gross income, or MAGI, adult or MAGI child Medicaid. What that means is, in the state of Ohio, we have allowed for people to be able to earn just a little bit more than what, or how should I say it, not just earn. We've allowed people to have a little bit higher income and still be qualified for Medicaid. They're not qualified for regular, but possibly they're for the MAGI. And really, it's a 5% difference, so it's not a big deal. This is a big one for our community. Medicaid buy-in for workers with disabilities. Anyone who has a disability does not have to be receiving a cash benefit, and who is working and can be working an hour a month is eligible to enroll in Medicaid buy-in for workers with disabilities. It's a very good plan. It even has some dental and some vision, and it guarantees that Part D prescription extra help that, again, most people need because prescriptions are skyrocketed, the cost of them. Then we have waivers. We work a lot with waivers within Fairfield County Board. These are some of the waivers that are out there. One thing to add to this, if an individual has a waiver and they're working, they might need to be an MBIWD as well. So they might need to have 2 different types. There's MyCare Ohio. It is also a type of waiver health insurance. It's only eligible in 28 of the Ohio's 88 counties, and Fairfield County is not one of them. And basically what it is a managed care Medicaid, excuse me, where they have a provider who just manages all the healthcare service. And I'm really sad that we don't have it in Fairfield County because it's a really good program. There's specialized recovery services, which it's a healthcare program, but it's still a waiver. Ribicoff Kids. There's Medicaid for parents and caretakers of relatives. And then we have the Children's Health Insurance Program. So again, my basic point to this is there's so many different types of Medicaid, Medicare. Just be aware that they're there and it may not be as straight as you think it is. And now my chart won't go. Okay, I already went there. Can't go down. Sorry about that. The key doesn't want to work. Okay. This is really, really confusing to people. You know, it's what's the difference between Medicaid and Medicaid waivers? And again, that hits our community a lot because we serve people who have waivers. Medicaid is health insurance. Medicaid waiver is a service program. That means they get help within the house with anything, bills, organizing, cleaning, cooking, transportation, training assistance. Medicaid waiver is not healthcare coverage, but if you're enrolled in a waiver, you have healthcare coverage. The entitlement in this situation just means that if one meets the eligibility requirement, they're entitled to receive the benefit. What is going on with my computer? There. I see so much confusion in this. If we have a person who's already enrolled in a Medicare premium assistance or savings program, and we are wanting to enroll them in a waiver, there's confusion that they have to become Medicaid eligible. If you're in, or the individual is enrolled already in those premium assistance programs, they are Medicaid eligible. So two things don't have to happen. It's already free and clear. Okay, bottom line. As I said in the beginning, when an individual says they have Medicare or Medicaid, it's a general statement. And I truly believe that providers, support people, caretakers, benefits consultants like me, and especially the individuals themselves, they don't need to know all the ins and outs of what they have, because there are people out there to help them through that. But it is good to understand exactly what type of coverage you have. And especially when a person becomes 65 and is eligible, there's all these options out there, and it's very difficult. I enroll people in Medicare who are not disabled, because I'm a counselor as well for OSHIP. And it's very complex and overwhelming, even for the most highly educated person. If a person needs help, there's a ton of it. Job and Family Services, that's for the Medicaid and for the Medicare savings programs. Most people are not aware of Ohio Senior Health Insurance Information Program, OSHIP. It's our state insurance program. Every state has a state insurance program that offers free counseling and services to individuals regarding Medicare. And for me, because I'm a counselor for them, when I'm serving the people we work with, I have the ability to go in and see exactly what type of health insurance they have and figure out things for them. Then, of course, Medicare.gov, Medicaid Ohio, and benefits consultants. There's plenty of them around the state of Ohio. And then, how strange. There we go. Duh. So that was kind of a quick run through. I kept it at a really high level, but I hope that it maybe makes you think about a few things, maybe have some questions about a few things. If you don't have questions now, but you run into something in the future, here's my email, my phone number. I'd be happy to assist with it. I think the majority of my time is going through Medicaid and Medicare issues.
Dorinda?
Yes.
Can you tell me if everybody has to go to managed care anymore if they have Medicare?
No. Well, you mean Medicaid?
I mean, Medicaid, yeah.
Okay. No, they don't have to go to Medicaid managed care.
So if they were put on managed care and their provider doesn't take the managed care, they can ask to be put back on to
yes, they have to contact.
Medicaid?
Yep, they have to contact Job and Family Services directly and ask to be put back on fee-for-service.
Okay, that's happened recently. I thought that we see, like a good while back, that everybody was being put on managed care. So.
Automatically, yes. Yeah, and there was also an issue with Job and Family Services telling people that if they were on a waiver, that they had to be in managed care. And that's not true.
Thank you. That's helpful.
Yeah, you're welcome. Everybody's going, yay, that was really a lot. Okay, move on.
I'm really glad that you know all of these things and that we have you so that we can check back in, because I don't know how anybody would ever be able to keep it all straight. So thank you for knowing all the things that you know.
Oh, thanks. Well, I don't know everything, but I'm fortunate that I work within a really good network of people. And I mean, outside of Fairfield County, you know, the state, if I don't know an answer, I can pretty easily get one. I bug people all the time. Hey, is this how not, do I understand this right? Or what am I not understanding?
Brenda, I don't have any questions in the chat for you, but if anyone has anything, you guys can feel free to unmute yourself and ask while we have her here. And then we're going to also save this, of course, on the YouTube channel. So if there was something that you want to go back and take a look at, you can do that. And I also have the PowerPoint that Dorinda sent me, so I can send that out as well.
Absolutely. And again, please feel free to contact me if there are any questions now or in the future. I mean, even if they're for yourself. I'm in that age group where, you know, a lot of my friends are turning 65, and sometimes my downtime is not downtime. We're socializing, but I'm talking Medicare. So thanks for attending. I really appreciate it.
Okay. Well, yeah, if no one has any questions, then I think we're good to go.